I guess that was a sign. Good afternoon, ladies and gentlemen. Well, good morning and good evening in some parts of the world. Welcome to the side event called Inclusion Counts, which we will use the next almost 2 hours to discuss about data-driven advocacy for the implementation of the CRPD. My name is Katarina Ivankovic-Knežević, and I'm a Director for Social Policy in European Commission, Directorate General for Employment, Social Policy and Inclusion, and I will be your host today and take you through share with you all the secrets relevant to the data-driven advocacy. Before we really start, I have few very, very important housekeeping rules. For those of you who need a sign language and who will be using the sign language, we are using 2 interpreters, and they will be interpreting the international sign language. Please, those of you who will be speaking, keep in mind that you do not rush through your presentations and that you speak nicely so that our interpreter have an easy job. We also have the captioning, which is available and it's integrated in the platform as subtitling, and it says subtitling full transcript A&D. And there is an external link to this in the chat box. The link has already been put there. So if you prefer to use it, please go ahead. On your screen, you will also have the sign language interpreter and the presentation slides. Only the interpreter and the person who are speaking at the same time will turn on their camera. And this is extremely important. Please turn off your cameras, and we should allow only the person who is speaking and the interpreter in order to have a smooth running meeting. The presentations can be downloaded from the chat box as well. And as you can see, all attendees are muted, but of course you can still ask questions. For the technical issues, use a chat box, and I believe you can send the questions directly to Diana, or just put them in the chat box. It's fine. We will find you and we will try to help. For all the content related questions, please use Q&As button and box. And we have seen that you can already ask, and you can already start sending your questions, and we will answer them towards the end when we have our Q&A session. If you will have too many questions and if we will run out of time, then we are going to send you those by mail. And just another housekeeping, and my last housekeeping point is that we are recording the webinar and transcript, and they are going to be available at the EDF and conference websites very soon after we finish with the webinar. So this keeps me this brings me to the end of this extremely important subject, which is the housekeeping. And still, I'm sure, and I apologize if some of you are having difficulties when it comes to the technique, but I guess this new reality put us in this very strange position. We also encourage you to tweet as you see. Please use the possibility, share the information, share the knowledge. These webinars are all about sharing, and this is so important to have in mind, and so important that the whole world see what we are going to discuss. Now I'm going to briefly present you, I'm going to put my official Commission hat and present you a bit about the work that Commission is doing in the area of disability inclusive data and the indicators. Some of you might know that Commission is now at the end of 10-year-long process where we implemented the European Disability Strategy that is coming to the end by the end of this year. We did a detailed evaluation what went well and what were shortcomings of the strategy, and we identify as one of the shortcomings definitely the monitoring system and access and frequency of access to the data on the disability. We have made some improvements, and we have to recognize that, but still the challenge is to include the disability disaggregated data in our regular activities, such as in the European Union. We have this the Eurostat, which provides annual assessment based on the so-called SILK data, which means the questionnaire-driven collection of data. And we are trying very hard to have the data in this so-called SILK on the annual base. We did not succeed yet. We are starting from 2021. We are on the biannual base, but we do hope that our new strategy, in which the relevance of data is going to be very prominent, is going to push in order that we manage and that we succeed to have the data collected on the more frequent and preferably on the annual base. Also, what we see is that it's for us, it's not only sometimes about the data, but it's also about setting targets. And this is another complex issue that I would like to share with you in the light of the European strategy, but also in the light of your national strategies and the different approaches. So I will be happy to hear from our speakers. Do they share same experience, and do they find it interesting and challenging point? When it comes to the disability inclusive data, we do believe in the EU believe that the disability mainstreaming with all the data that needs to be that are relevant in various fields should be disaggregated and should be inclusive. And still, as I said, many challenges to come and many developments to be done, I would dare to say. So by this, I would like to stop for this moment, and we can continue our discussion, and we can maybe have a bit more during the Q&A session when I can elaborate more on what we plan to do in the EU. Now we move to the next, and this is the next item of the agenda. And I'm going to ask a very well-known, I would dare to say, a person, Miss Maureen Pigot, to give us her opening remarks. And Maureen is going to speak about the role of DPOs in data-driven advocacy, in particularly to the relation of the I2I project, or inclusion to now help me, Maureen.
Innovation to inclusion.
Yes.
Innovation.
Integration to inclusion project. So please, you have the words.
Thank you very much, Katerina. It's great to be here today, and thank you to all of the participants and panelists for joining us to discuss this very important topic of how we use data and how people with disabilities and their organizations are involved in that and strengthen their advocacy through the use of data. So the European Disability Forum, usually known as EDF, is an organization of persons with disabilities in Europe. We represent 100 million people with disabilities in Europe through our member organizations, who are national disability councils in each of the member countries, and also the European associations, networks of people from different disability groups or specific disability issues. But we are governed and run by people with disabilities and their families. So although we're a European organization, we have always been involved in international cooperation and believe very strongly in the importance of international cooperation and international development. So over the years, as EDF has been involved in the international networks through IDA and in other ways, we have received increasing numbers of requests to get involved in international development and to support the development of regional DPOs in particular. And we wanted to respond to that in a strategic way, rather than being pulled into projects and taking, if you like, a scattergun approach. So in 2019, EDF produced a strategy for how we would work in international cooperation and development called EDF in the World. And I believe there's a link to the document in the chat box if you want to follow that up. And that shows our approach to it and our approach to promoting the participation of organizations of persons with disability in international development and cooperation, not just as beneficiaries, but as experts. Another important part of our role is to engage with the European Union to be more inclusive in its international cooperation, external action, and humanitarian action. As we know, the European Union is a very important participant and funder in international cooperation and development. And in this context, we were delighted to be invited to be part of the Innovation to Inclusion project, I2I, which is funded by the Foreign and Commonwealth and Development Office of the United Kingdom. And I think we should at this point acknowledge the funders who make it possible for us to participate and to do this very important work. So, strangely, disabled people's organizations are not automatically included in development or in the partnerships put together by development agencies. And so we worked on this with a consortium of development agencies and DPOs to produce a guidance note also in 2019, a very busy year. So in December 2019, we produced a guidance note on the role of European DPOs in international cooperation. A large number of our member organizations and their members in turn at the national level are involved in international development. But still, as I say, there's a gap in the knowledge of the work that they do and of the benefits of working with disabled people's organizations in international cooperation. So our guidance note was put together by consultation amongst our members and amongst development agencies on the benefits of working with disabled persons organizations in delivering programs in international cooperation and development. We hoped by this to show the importance and in fact pull out the lessons from having done it. So the 5 main reasons that we identified through this process were, first of all, a political reason for working with disabled persons organizations is the power dynamic and the very important principle of nothing about us without us, so that no decision should be made about disabled people or their lives without the involvement of disabled people in those decisions. There are also legal reasons for it. The Convention on the Rights of Persons with Disabilities, CRPD, states that very clearly, that the involvement of people with disabilities in all of the decisions that affect their lives is an obligation on states parties, and it strengthens decision-making. And of course, it helps the states to comply with their obligations under the treaty. There are technical reasons also for the involvement of persons with disabilities because of the expertise that persons with disability bring to the table and to those partnerships. People with disabilities know their circumstances best and are often best placed to come up with the innovations and the solutions to help to solve the issues that are raised. There's also an important point about financial sustainability. By participating in the international development field, the amount of money that the agency is able to, the Disabled Persons Organization is able to access goes a long way in strengthening the capacity of the organization to participate and also to be effective at the national level, and to do that in a sustainable way into the future. So that strengthens the organization and it strengthens the national connections so that there's better and higher quality policy input. And of course, the policy work, the involvement of disabled people's organizations brings a coherence between the national and the international in formulating policy. So those were the main learning from the work that we did with development agencies and DPOs on the participation of European DPOs in international cooperation. One of the other very important notes was that European DPOs should not replace the national DPOs in the global south in international cooperation. And I think that's a very important point to re-stress. And so if a development agency invites a European DPO, that does not replace the national DPO in the partner country. It's an addition to. So this guidance note is part of an open conversation about the role of DPOs in development, and we're open to continuing that conversation here this afternoon and afterwards. So getting on now to the Innovation to Inclusion project. This project works in Kenya and Bangladesh and is addressing Article 27 about equality of opportunity to employment and Article 28, equality in social protection systems. The project is about market-based employment, so employment in the open labor market and understanding the market conditions and the market needs and ensuring that there are the good exchange of information and a good match between the training and preparation and ambitions of people with disabilities and the needs of the labor market and engagement with employers. So data was in fact a very important part of this project from the outset. The project gathered information on the market conditions in both Kenya and Bangladesh and was looking at promoting sustainable economic employment for persons with disabilities, and in particular to ensure that women have equality of participation in the open labor market. You will not be surprised that the project, like everybody else, ran into COVID-19 and the problems of a global pandemic. And so the project responded to this by practicing what it preached and saying to advocate for disabled people to advocate about how their lives are being affected, we need the data. And so the organizations in Kenya and Bangladesh, working with EDF and other project partners, switched the project to have a different focus for this period and to gather the data that was needed about exactly what impact COVID-19 was having on people's lives. And you will hear more about that. And I think come to the conclusion that very good use was made of data and that the involvement of people with disabilities in collecting it, first of all, designing the study and actually collecting and then using the data was tremendously invaluable. So you will hear more about that from Derek and Albert. And I'd just like to say again, to thank our funders and our partners in doing this important work. And I look forward with you to hearing about the use of data in the I2I project. And I'll hand back to Katerina. Thank you.
Thank you very much, Maureen. Thank you also for keeping the time, and it's very crucial that and important that we keep the timing. Also, I would like just to complement what you said, and you spoke about this concrete project, and we will hear in a second the main aspects of the project. But I would like to share with you that when it comes to really promoting and defending the rights of persons with disabilities in the context of the international development cooperation, and also for the neighborhood and the enlargement countries, and in the context of the humanitarian aid, this is very important for the EU. This will also be a part of our future strategy, because the fact that EU is the major world donor when it comes to the persons with disabilities, and we really see it as a cornerstone of our policies for social inclusion and human rights in cooperation with the partner countries. We do it in the light of the EU Gender Action Plan for the external cooperation, and we do it in accordance to the EU Action Plan on Human Rights and Democracy. So in the future, we also plan to make sure that the partner countries and territories involve social partners and DPOs in their countries to participate in the design and implementation of the policies that affect them, and that they receive sufficient trainings and enhance their capacity. For us, this is extremely important, and this is something that we will pay attention in our future work, as well as we have up until now, and even strengthen it. Now we go to, I say, the core of our 2 hours meeting, and we will hear about concrete actions. So I will give first the floor to Derek Shimoli from Diversity and Inclusion. He's Diversity and Inclusion Officer of Kenya Union of the Blind. Please, Derek, share with us your experience about gathering data and developing advocacy. And you have around 17 minutes. Towards the end, I will warn you, Derek. Is that okay?
Derek, you're still muted. You need to unmute.
Yes, we don't hear. Derek, can you please unmute yourself?
Yes, good afternoon,
Perfect.
Good morning. First of all, I would like to kindly request for reasonable accommodation because of my disability and I'm using Braille. Is it granted?
Sure.
Okay,
Go ahead.
Thank you. So 17 minutes will not be enough for me to give
20 minutes, Derek.
Okay, then I'll share a brief of what Kenyan DPOs are doing around Articles 27, work and employment, and Articles 28, adequate standards of living and social protection. And we look at gathering and developing advocacy strategies around CRPD, Articles 27, which is work and employment, as I alluded earlier, and Article 28, adequate standards of living, and how Kenyan DPOs are engaged in monitoring around CRPD. So let us look how CRPD has been implemented in Kenya briefly. And there is goodwill in the implementation of the CRPD in Kenya. This is evidenced from inception reports, which we as organizations of persons with disabilities, developed Our reference points originated from desk reviews on existing policies, legislation, international treaties, and regional obligations to which Kenya ratified or has acceded. However, an overarching approach in this direction is with regard to the premise on the realization of the actuality of these ratifications, so that the provisos that are envisioned in it, can benefit persons with disabilities in Kenya. We look at how persons with disabilities are engaged in data monitoring.
I believe we have some technical difficulties with Derek.
Of course.
Okay, he's back.
Sorry? Yes?
Yes. We lost you for a second, but you are back. Thank you.
Okay. So I was saying there's huge disparity, yeah, with data compared to the global data and the statistics of the global statistics and the government statistics. And this is due to the fact that persons with disabilities or organizations of persons with disabilities have not been involved in the process. There are no incentives that can, make persons with disabilities, yearn for registration. Okay, so that we're able to gather and collect their data. The body which is charged with, registration, which is the National Council of Persons with Disabilities, there has no coordination with persons with disabilities, and hence they lose out on capturing the actual data for these groups in this country. And mainly this is attributed to the fact that they have not been able to collaborate the process with organizations of persons with disabilities. So the process is slow, and the process is never accurate. So that is a very great concern, and I think this project will help us in addressing it. Yeah. Then, when we look at Article 28, which is talking about adequate standards of living and social protection, you realize that the scheme is there, but it is hard for us to measure, or for organizations of persons with disability to measure the severity of this type of disability. So there's a huge disparity there. Then when we look at the data portal, which we are now using to gather data, we say that the data portal conforms to the Web Content Access Guidelines level A. So it has basic conformance, and it reports on 16 thematic focuses, 16 thematic indicators. And in the case of Kenya, we are looking at the two specific indicators under resources, which is Article 27, work and employment, and Articles 28. This is a very comprehensive tool which we as persons with disabilities can use to develop our advocacy strategies. It in line with the global development goals known as the Sustainable Development Goals, that is the MDGs. Then we also looked at the various workshops that were involved, that is the online workshop, and the recently concluded workshop in Nairobi, where we as DPOs were actually responding to the data that we had collected, and were able to form advocacy strategies where we looked at our key messages, which must be clear, concise, and complementing. And then the messages need to secure some ideal moments where we are able where
Question.
here we are looking at where to disseminate the messages. Are they the duty bearers? Is it the legislation, or agencies are conferred with implementing the policies or the legislations? And then we also looked at our products, and we defined what products we need to develop. And then we saw that the formats could be either in audio, they could be in journals, or they could be in podcasts. Then we also looked at the channels to which you can use as vehicles so that the messages are able to reach our audiences. And we looked at the social media platforms, the websites, and any related casts that we can be able to use as avenues to reach out to our target audience. Then we also looked in the workshop, both the online and the physical workshop in Nairobi. We also looked at the timelines. Now, advocacy, as you know, is a process. So we mapped out, the timelines where we at least need to have a realization of either a milestone, an outcome, or even that theory of change. So that is the precision that we put on that. And then also looked at division of labor, where organizations were given roles on how to design, as lead organization, how to design advocacy strategies and monitor according to the records that we had collected through desk reviews. Then we all had an acclamation, and we said that these tips that we've studied, we have gathered, and the records that are in profile would go a long way in helping us develop our advocacy strategy towards the realization of the implementation of the CRPD in Kenya, with specifics on Article 27, work and employment, and Article 28, adequate standards of living. Thank you. Thank you.
Thank you very much, Derek, and thank you so much for sticking to your time. And it's really, you made it in 17 minutes.
Thank you.
Yes. That's good to know. So I see we started receiving questions. Thank you so much, and please, we will be paying attention to them. I would also like to propose that when you ask the question, maybe you can already identify to which panelists are you asking the question, and then I'm going to read them in the end. Now we go to our second speaker, and our second speaker is Albert Mola. He is Executive Director of Access Bangladesh Foundation, to see how the project pivoted actually to address the coronavirus situation and producing so-called COVID-19 influencer pack. I'm really interested into to hear what you have to say. So please, Albert, you have your 10 to 13 minutes, please. Do we have Albert with us?
Yeah, thank you. Can you hear me?
Yes. Yes, perfect. I'm going off now.
Thank you, Katharina. First of all, I would like to welcome all the participants to this presentation. So I just want to share how the I2I project pivoted to address COVID-19. So I will speak on these particular issues. And again, I would like to welcome you from Bangladesh, especially the DPOs are engaged in Innovation to Inclusion project. So, you know, the I2I project overall goals and objective, but you know, in Bangladesh, the COVID-19 started in March. So I2I project turned its focus on COVID-19. This is a very, very important message, you know, that based on the situation, I2I project turned it focus on COVID-19. And very specifically, by conducting a rapid assessment in Bangladesh and Kenya. So I will say that it was a very, very important decision from the I2I to conduct this rapid assessment. So the main point, you know, the DPOs are engaged since beginning of the assessment. So this is a very important area which I want to share with you. You know, the DPO's contribution in conducting the rapid assessment was really remarkable. So the DPO partners were engaged actively in the entire process of the assessment. 10 DPOs and 3 implementing partners are engaged in developing questionnaire, and 10 DPOs and 3 implementing partners, they collected data remotely. You know, the situation in that time was a lockdown situation in Bangladesh. So there was no movement, the vehicle movement was stopped. So in that situation, the DPOs, they collected data remotely. So it was very new for, particularly for DPO, not very easy job, you know, to collect data remotely, but they did this difficult job successfully. So the methodology, which I want to focus in a very short manner, you know, the study, it was a rapid qualitative study, and the number of respondents with disabilities, 135 in Bangladesh and 177 in Kenya. And the respondents included persons representing a wide diversity of disability, including intellectual, physical, visual, hearing impaired, and mental health issues. The study was conducted mainly in the areas of Bangladesh and Kenya, where innovation to inclusion program being implemented. Data collected in between 20 April 2020 to 30 April 2020. So it is important to mention here that, you know, the COVID started in Bangladesh in March. So it was the beginning, you know. Why I'm mentioning, you know, maybe later I will share the findings. So you will see the findings we derived from the beginning of COVID-19 situation in Bangladesh. I already mentioned that the interviews and discussion are conducted remotely. Now I would like to mention the DPOs names, those who are engaged in conducting the assessment. Would like to mention their name to recognize, particularly from this platform. So in Bangladesh, I mentioned that there are 10 DPOs, and the names are Alliance of Urban DPOs Chittagong, Bangladesh Disabled Development Trust, Bangladesh Society for the Change and Advocacy Nexus, community-based Disabled Child Protection Organization, Disabled Child Foundation, DCF, Disability Development and Research Center, Human Rights Disability and Development Foundation, National Council of Disabled Women, National Grassroots Disability Organization, Women with Disabilities Development Foundation. So all those 10 DPOs are engaged in conducting the assessment. So now I'd like to mention the Kenya-based DPOs. Here also 10 DPOs work in the assessment work. So Vision of the Blind, TINEDA, Women Challenge to Challenge, Albinism Society of Kenya, Cerebral Palsy Society of Kenya, Deaf Empowerment Kenya, Ecumenical Disability Advocates Kenya Network, Kenya Paraplegic Organization, Kenya Union for the Blind, United Disabled Person of Kenya. So these are the DPOs. Actually, they work actively in conducting the assessment. So I just mentioned, to recognize their work, to recognize their contribution from this platform. The major findings are derived from the rapid assessment. So if we say the people with disabilities are confined in home due to lockdown since 26 March, feeling isolated with less contact with friends and family, unable to access information on COVID-19, including public health measures. In that time, they are heavily focused on COVID issue. So general health service and other health facilities are really that was not available for people with disabilities. The difficulties in getting medication, health facilities, troubles in paying house rent, hardship in managing food, daily commodities, hygiene items. So high price and unavailability. I just want to mention that in that stage, the materials, hygiene materials, were not available in Bangladesh. So there was a shortage. So the price was very high. So this was a problem in those the time when we collected information from the ground. Limited access to PPE, mask, and gloves. And also there are other remarkable findings. So the people with disabilities, they were unable to work as everything is closed. So as I mentioned, that vehicle was stopped because of the lockdown and the country. There are a lot of restrictions were there. Unable to work from home due to nature of work. Usually the people with disabilities in Bangladesh, they mostly work, the blue collar job. So the nature of job actually is not possible, to allow them to work from home. So it was a really problem particularly for the employees with disabilities. Employers do not allow flexible working facilities. So anxiety for not receiving salary. So in particularly in March, in April, May, most of the industries, they decided, not to give salary. So this was a really problem for employees with disabilities. Extremely concerned about continuation of job, because the industry, they were thinking to lay off or shut down their operation. So this was a problem during data collection from the ground, not being able to find another job, because in that time, if they lose their job, it is very difficult to find another new job. So the respondents, they also expressed that the huge possibilities of losing job. So fear about economic recession and huge uncertainty about the future. So because of uncertainty, they were in tremendous mental stress. So these are the major findings we have from the rapid assessment. So I will say that that the study, the assessment which conducted by the I2I, it was a really important in that time, because if we want to do the evidence-based advocacy, so this is the only way to collect information from the ground, and based on that, we need to formulate our advocacy strategy. So from that ground, the assessment was really important, important task. So now I just want to move, the another document which developed based on the rapid assessment, which is very important, as I mentioned, that the evidence-based advocacy. So this document called Disability and COVID-19 Influenza.
Albert, could you wrap up a bit? Sorry for this.
Sure. So this influenza package actually can be used by DPOs as an advocacy tool to influence decision makers to make response and recovery measures more inclusive for persons with disabilities. And this influenza pack shows the challenges faced by persons with disabilities. And also very important thing, this pack gives roots to influencing change in attitude, behavior, and policy. And this will make response and recovery measures more inclusive in line with CRPD. So this resource pack actually for persons with disabilities, their families, communities, the representative organization of people with disabilities, and other organizations, those who want to influence the decision, and how it will help, so it will help to raise awareness of current challenges faced by persons with disabilities, and it will help to understand what needs to change, and also to know the route to influencing change in attitude, behavior, and policy. And if I say how to use it, the document actually contains 7 thematic sections called influenza resources. So influenza resources can be used independently or together as part of larger strategy. So the resources will help the development of advocacy strategy. So the advocacy strategy, if we mention that the raising awareness, social mobilization, and lobbying, So the influenza pack, I mentioned that, the 7 influenza resources are there, like setting the sense, inclusion in decision making, accessible information and communication, accessible, inclusive, and targeted support, employment and economic independence, gathering and using disaggregated data, and finally the useful guideline. So all these influenza resource, each influenza resource, articulated the challenge, way forward, and what actually DPOs can do. So this is a very useful, to influence the decision maker. So finally, I would like to conclude that, if we want to have disability inclusive response to any crisis, persons with disabilities need to engage in the preparedness activities. Thank you very much.
Thank you so much, Albert, and sorry for interrupting you, but we are really running over the time, and I really ask our next panelists to please stick to the time. And our next panelist, Diana Dalton, she's the head of Inclusive Societies, the UK Foreign Commonwealth and Development Office. And Diana, please go ahead. The floor is yours. The screen is yours.
Thank you very much. Can you hear me okay, Katrina?
Yes.
Yes.
Perfect.
Excellent.
Perfect.
Okay. I'm going to try to keep it brief. Obviously, it's fantastic to hear directly from organisations who are much closer to the ground than we are as an organisation. Let me just start by introducing myself. So I'm Diana Dalton, and I'm head of what's called the Fcdo's Inclusive Societies Department. And within this department, I'm responsible for our work on equality, leave no one behind, and all inclusion issues. And in essence, that really is about working to ensure the reach of UK AIDS work to the most vulnerable and marginalised. I'm sure a lot of you are aware that the Foreign, Commonwealth and Development Office has only just been created very recently by merging DFID together with the Fcdo at the beginning of September. And this has been really a very big change for us to organise ourselves around, with the aim of bringing development far closer together with diplomatic priorities and obviously wider UK interests. So we're working through those changes at the moment and the challenges that those bring. And obviously that's alongside the impacts that COVID has had on the UK economy itself, and the resulting impact then of the amount of budget that we have to spend on our own development work. So that's unfortunately been a downward trend that we're also trying to manage, hopefully a very temporary one. I just want to acknowledge first that this has clearly been a really tough year for civil society organisations all over the world, including organisations of persons with disabilities. And I wanted to say a huge thank you to for everything that you continue to deliver, as evidenced by the presentations here today, against the huge challenges that the pandemic has presented. For us, it's really incredibly important to hear directly from organisations who are working, as I said earlier, much closer with communities and with persons with disabilities directly than we are able to. Your ability to gather real-time information of impacts on the ground, your perspectives, and critically to help us to learn lessons. We recognise the value of localisation across everything that we do thematically, to ensure that last mile delivery of our support, in whatever sector that we're operating in, is seen through, and that the creation of new opportunities is maximised. And we're trying to strengthen our accountability as an organisation on shifting that power of decision making to a country level to a greater degree. Just to talk very generally to begin with, the UK set what we think was a high bar on international action on disability. It's been a priority area for us to focus on over the past few years, but really culminated in a successful Global Disability Summit in 2018. And I know many of you were probably involved in that in some way, and we do recognise that there's still a very steep hill to climb, and we recognise that there's an importance of securing wider commitment to do more. So with that in mind, I think the creation of the Fcdo provides quite a good opportunity for us to work with even more partners across a wider stage, enabling us to influence with broader scope and a far wider global physical presence. DFID was an organisation, I mean, I felt to me like it was a big organisation of 3,000 people and around 30 country offices, but the Fcdo is much bigger as a combined department. It has 17,000 people and around 280 country posts, if I'm correctly remembering it. And obviously this gives us quite a lot of opportunity to create a louder voice, have more extended reach on disability rights, and consequently work with a more comprehensive range of organisations for persons with disabilities. So I'm really hoping that's what the future will hold. And as many of you know, DFID has been working to implement its first disability inclusion strategy, which was launched shortly after the summit in December 2018. That aimed to embed disability inclusion across the whole of DFID into systems, structures and culture. And just to remind you that the strategy itself has 4 strategic pillars: one on inclusive education, one on social protection, one on economic empowerment, and then a 4th on humanitarian action. And we have some cross-cutting themes around tackling stigma and discrimination, empowering women and girls, and access to assistive technology. We recently published a progress paper on what had been achieved since that was published. It's fair to say we've not achieved everything that we set out to do. There's been quite a lot of challenges and changes on the way that have made that difficult, but it does illustrate, the paper does illustrate that we have done a huge amount across many countries and across many teams of the organisation, working with a wide range of really critical partners. So we're proud of that, but as I say, there's more to do. The range of achievements are only possible, completely possible, through our partnerships with strong people and effective organisations. So just to name check a few of those, obviously Leonard Cheshire and Sightsavers, who run a large programme consortia for us, but they are large member organisations, so there's many more involved. The International Disability Alliance, the Disability Rights Fund, and the UN Partnership on the Rights of Persons with Disabilities. And I just want to be very clear here that we value these partnerships because they help us to deliver very much shared objectives, and that's obviously an important factor for future success. So when it comes to what next for Fcdo, there's a huge amount for us to plan for. We are intending to refresh this disability inclusion strategy in early 2021. With the view that we need to make it relevant and appropriate for this new department, building on what we worked towards as DFID. This will make it fit for purpose for the new organisation and build in a new focus on important issues such as safeguarding, obviously COVID-19 recovery and climate change. And obviously that's a high priority for the UK as we get set to host COP26 in November next year, up here in Scotland. Filthy weather here today. So we all know that unless we take explicit steps to include people with disabilities in policies and programmes, then we effectively exclude them. And COVID-19, as we've just heard now, has made this even more stark. We know that disability communities around the world have faced unprecedented challenges over the past 12 months, and the data coming out on that is quite dramatic. But what it does provide is an opportunity to build back better. There are huge lessons that we've learned along the way, and we do intend to take these into Fcdo as we refresh the strategy and set our new objectives for the future. Yes, we definitely need data and evidence to get this right. So we're trying to build this through two of our programs, through the Disability Inclusive Development Programme and an Aid Connect programme. And our teams also need practical support in their day-to-day work to do this well. So we have a disability help desk that you may be familiar with, and a fantastic disability inclusion team in ISD, which I'm proud to say does a fantastic job, and I know works very well with many of you. It very much has its place in the new Fcdo. Secondly, we need leaders and champions, not just senior leaders, but people across our own organisations in every team and every department, raising this in every discussion, particularly those who have a lived experience. We've got a fantastic internal network of disability champions that we set up, and we need to build on that further as our network has grown. There really are conduits to those of you active at a country level in particular. No issue is too big or too small to think about inclusion. So this includes our work on girls' education, on global health and climate change. These are all big issues for next year. So we have to make sure that we are thinking equality, inclusion, and disability inclusion in particular in all of those big events next year and big campaigns. And we must join the dots with other inclusion work that we do. So don't think about inclusion issues in silos, but think about them very much intersectionally. And then when we're talking about better disaggregated data, which has obviously been a focus of today, we've learned that this from the Girls' Education Challenge programme. Every project under this huge programme has used the Washington Group questions to collect disability data. And this has had a lot of benefits. Besides the data collection in itself, it has helped general education practitioners to think about the children that they're already reaching, with a range of non-visible impairments. And in Uganda, there's an example of one project that found intersectionality is a more significant factor in educational marginalisation than impairment on its own. So girls with disabilities with multiple levels of disadvantage have then significantly lower levels of literacy and numeracy compared to less marginalised disabled girls. May not be a surprise to many of you who are working so closely on these issues, but obviously that's really important when you have a big global programme with a lot of investment in it. So the collection of data is having a direct impact on those education approaches. Finally, and most importantly, ensuring the meaningful involvement of people with disabilities and their respective organisations is central. We must collaborate with organisations of people with disabilities in a way that works for them respectfully and with plenty of time for input. You have the knowledge, expertise, you have the personal experience. So we are determined to make more use of that and utilise it and we have already made that one of the minimum standards of our strategy. So a priority for us is to hold the rest of the organisation accountable for meeting those minimum standards. So I'm going to finish there. I hope I've stayed within time, but thank you so much for giving me the space to speak here today. I'm looking forward to a short Q&A session, so thanks very much. Over.
Yes, thank you, Diana, and thank you so much for pointing to very important aspects and showing what you do. And I know that the time of reorg is not always the easiest time, but I'm sure that you are doing a great job. So now I will give the floor to Jess Shaban, and I believe everybody around the screens and around the world knows Jess because she's well-known activist and well-known engaged author. She is DPO engagement manager in the Leonard Cheshire, if I pronounced it right. So Jess, please, you will guide us through the Q&As. If you need my help, I'm here. And also you will represent the summary of today's findings and discussion. So the screen is yours.
Thank you very much, Katerina. Yes, I am the DPO engagement manager at Leonard Cheshire, which is actually the consortium lead of I2I. So given that we've only got about 12 minutes to put some questions to our speakers, I'm going to try and make sure that we give at least one question all our speakers because we are running over. So speakers, please do be brief. I think our first question I'm going to put to Maureen because it's related to some of the development partners and really want to know who are some of those development partners or agencies that support data collection in related programs.
Well, I mean, I think we've been talking about a project which is funded by the Foreign and Commonwealth Office, and it did that. It was the I2I project has data and the use of data at its core. So it's, I think, in itself a good example of that. I'm sure Katerina would maybe be able to give more information on some of the EU funding programs that would similarly encourage disabled persons organizations to develop their capacity to use data. But I think most donors now ask you to produce the evidence and to use data in your impact assessment and in evaluating the program. So I think it's very much built into most donor agencies' ways of thinking now. And I think we just can't overstress the importance of it. I could go on, but I won't because I know you're anxious to give everybody a chance to get in there. But happy to pick up the discussion with people outside the meeting as well.
Okay, that's great. Thank you, Maureen. That's really, really helpful. I don't know, Katerina, did you want to jump in there with anything, or do I move on to the next question?
Just to say that yes, it is very important, and we do ask for the evidence-based in most of our projects, but it's also important to acknowledge that we do not always have the data. And that is something also to have in mind, and that does not mean that we do not need to do the action in XY state, because that might help in order for them to get on board and to start collecting the data. And that is important to have in mind. Jez, I don't know if you noticed, but we have 2 questions in the chat.
I had, oh no, I'm
Not
not.
in the chat, in the Q&A.
Yes, I know, I have that. I'm just about to go in those, Katerina. Okay,
Okay,
so
sorry.
that's fine, I've got them, no problem. So we thank you very much, actually, Katerina, for also picking up that question. So one of the questions in the Q&A, and please do keep them coming, we want to hear from you, is how can we actually make sure that people with intellectual disabilities, so we're talking about marginalized groups here, are included in data collection? Because often surveys are not accessible, or they're not, people are dismissed for being incapable, and therefore that data is not, they're not even approached. Derek, is that a question that you could answer from your experience in Kenya?
Yes, I think that question is more related to the work we're doing. And I would like to respond by saying that there is that aspect of coordination and collaborating data collection processes by national federations and agencies that are conferred or given the responsibility of collecting population data population. So I think there's no linkage, or that synergy is, or that common bond is yet to be realized, to be able to realize that process of who are either severe or who have disorders that people may shy away from getting their data. So I think coordination and collaboration here. Thank you.
That's great, thank you. Albert, actually, I'm going to ask the same question from you, just to try and get a slightly different perspective. In terms of, in terms of the data collection that you did during the COVID survey, how did you adapt and collect that information for people with, amongst the DPOs with intellectual, and how did you reach them?
We had telephone conversations for the COVID data collection, and that is how we were able to reach the persons with disabilities, because you remember there were travel restrictions. So the only other way out was to read them through, telephone conversations. Thank you.
Yeah, thank you, Derek. Yes, I was actually addressing that part to Albert to see if he also wanted to pick up on that.
Yes.
Yeah, Jazz.
Albert, yes.
In Bangladesh, all the data were collected through telephone. Telephone sometimes, sometimes the Skype. These are the way we collected data from the respondents. Skype, telephone.
Yes, but I think the question was more about just wanting to find out a little bit more about people with intellectual disabilities and actually reaching the marginalized groups. Was that relatively easy through through the systems that you used? I think because obviously these are a group of people that tend not to be able to pick up and get involved and have their voices heard.
Yes, yeah, very good question. Because we mentioned that the respondents included, all types of people with disabilities, including mental, psychosocial, psychosocial and intellectual. So the way we collected, the main, we use the DPOs. So the DPOs actually, they are very close to the participants, to the respondent. So they have a good connection with the person, and they were connected with the DPOs. So that's why it was easy to collect information from those marginalized group, you know. So if we use the enumerator from other area, like, you know, if we actually we didn't use the enumerator from other sector. The person engaged in DPOs, they were very good connection with the persons. They are members, you know. Most of them they were the member. So it was very easy from that ground. Yeah.
So just in addition, that very particular data from persons with mental disorders was collected through DPO, as my colleague says, but from their caregivers. The caregivers are these people who, you know, stay with these people day in, day out. So they're able to give, you know, concrete information, as opposed to when you want to directly engage with that very particular individual. So through DPOs who have databases of the caregivers of their respective individuals. Thank you.
That's brilliant. Thank you for your very full answer, sir. That's really helpful. We're actually running out of time, but I just wanted to make sure we got through everybody. And there's a question particularly to Diana, if you could be brief though, Diana, but what can actually be done to motivate development partners to invest in data collection activities affecting people with disabilities in particular?
When you say development partners, who do you mean? Do you mean like donors or international partners or anybody?
Well, I mean, the private sector, those more and more private sector partners are being requested to collect data. Obviously, a lot of the donors and also donors partners and so on. And that's often quite difficult, you know, that the donors, the partners that you work with, you know, investing, it's not necessarily a requirement.
No, yeah, I mean, and it is, so to be honest, inside Fcdo, we are lobbyists. Like, we're all lobbyists, but inside our own department, we're lobbyists for data disaggregation, and it doesn't happen as much as it should. And when it comes to, you know, our big multilateral partners, I'd say it's pretty mixed performance, even on quite basic things like gender disaggregation. So going further than that always seems like a particular challenge that they struggle to meet. But we definitely, I mean, if the Fcdo is a funder, and then you have sort of downstream arrangements, we would write it into our own business cases that's a requirement. And we've definitely got a stronger learning that's based on concrete evidence coming, being hardwired into business cases that then results in the design of the program and the requirements for delivery. So when we've got a bit more control, it's possible. But when you're trying to sort of make the case for strong data disaggregation and a more evidence-based decision making that's obviously got data at its heart, then I'd say it's still work in progress, and you know, it's still a case of making it really clear what the benefits of that are. But I think, you know, if I look at where we were even just 5 years ago, we're in a much stronger position. We actually have a new part of the Fcdo, which is very much about performance, standards, accountability, data, use of research and evidence in development. So I feel like that is, and you know, it's all informing our future business planning processes. So I'm confident that it will be a strongly identified priority as we move forward into future programs. Sorry, slightly woolly answer, but yes, I can expand. If we've got more time, probably I'd have a chance to expand.
Brilliant. Well, I found that very helpful. Well, thank you very much, everybody. We're out of time for questions. I've got about 30 seconds to just give a tiny summary, which is pretty much about ensuring that people with disabilities really must be involved in all preparedness if we are going to have responses that are going to be inclusive, but also, as we've heard, appropriate. So I really would encourage everyone here to download and implement some, if not all, of the guidance that's in the influencer pack. I think the link to that is in this is the Eye2Eye influencer pack that was mentioned earlier on. So that's in the chat box, so please do grab that. And the other one, which is a big one for me, is really about the importance of implementing those lessons learned when considering next steps. We certainly picked up that today, including the most important one being that meaningful involvement of people with disabilities and their respective organisations in putting together those next steps. I think I'm going to leave it at that now and hand back to Katerina for your closing remarks. Katerina, thank you.
Yes, thank you very much, Jez, and thank you all for, I believe, really interesting discussion. I have to say, for me as a policy maker, it's always good to see the concrete projects and to see concrete outcomes, and therefore I thank you, Derek and Alfred, for I see the dedication that you in your approach to the project, and it's more than just another ordinary project, and it's really great to see how much attention you put to it. Also, I will take the lessons learned and share them with my colleagues. And before I end, I want to thank wonderful EDF team and to all who were involved in the organization, to Diana and Gordon and Raquel, and you have been doing a great job. And sorry if we were all very demanding customers when it comes to Zoom, but nevertheless, this is the new reality, and this is what we are facing. So I believe we are just on time. Once again, I thank you all. Have a nice day, have a nice weekend, and please stay healthy and safe as much as possible. Bye-bye.
Bye-bye. Very good.
Thank you all.
Imeisha, sio?